Okay. Hello. My name is Emily Cheney, and I am an accredited cognitive behavioural psychotherapist or CBT therapist. This means that I'm trained to help people who are experiencing difficulties with depression and anxiety disorders such as OCD, health anxiety, panic disorder, generalised anxiety disorder, and post traumatic stress disorder, among others. I'm also trained to work with people experiencing long-term physical health conditions, and that can include things such as chronic pain, fibromyalgia, and IBS. And I help those people to adjust to and manage their condition. I am the co-founder of Empower You Psychological Services. The other half of Empower You is my colleague, Emma Mudge, who is a coaching psychologist and works with individuals, groups, and businesses to improve their psychological health and well-being. We both work online, providing sessions of CBT or coaching psychology to individuals, and I also work face-to-face from a clinic space in Rochester High Street. I'm really happy to be here talking about pain and psychological health and how you feel, what you think, and what you do matters. So, why is thinking about our psychology important when we think about pain? So I have some stats for you here to illustrate the link between pain and our mental health. So it's been estimated that 43% of adults in the UK live with some form of chronic pain. Individuals with chronic pain are at higher risk of developing mental health disorders. To illustrate this, a 2017 study estimated that up to 85% of people who experience chronic pain can also experience depression. And just from these figures, we can see that the impact and the significance of pain on our psychological health is huge. So what I want to do now is introduce you to a model called the biopsychosocial model. This is a way of looking at what influences health and illness or health and wellness. So there's three different parts to this. The first one is our biology, and this is what goes on with our physical health. This can include things such as our genetics, hormones, brain chemistry, and immune system. And this part of the model essentially looks at how our biological systems contribute to our health and well-being. Next, our psychology. So this will include our mental health, things like our personality, our thoughts, emotions, and behaviours. And all of these things affect our overall well-being and health. And then finally, social. So this means our environment. It'll include relationships with family, friends, partners, our social systems, such as at work or at school, the area that we live in, our culture and religion, our support networks, our socio-economic status. So that includes things like our living environment, money, our job, what resources we have available to us. And again, all of these factors have a role to play in our well-being. So when we have a goal of being well or improving our health, we need to understand what's going on in all of these areas to know what is having the biggest impact on us and what is helping us and what is perhaps hindering us in these areas. So for example, if someone is experiencing pain and has difficulties with their mental health and also overwhelming stress at work, then perhaps just painkillers probably isn't going to mean that they then become well, whatever their version of well looks like. Similarly, just improving mental health without addressing pain and the stress at work might also mean that they don't become well either. And we know that pain has a significant impact on all three of these areas. So why do we experience pain? Pain is described by the International Association for the Study of Pain as an unpleasant sensory and emotional experience associated with actual or potential damage. Pain is a vital experience that serves a protective function for the body. Pain can be viewed as an internal alarm system that alerts us to something that is or could be harmful to the body and therefore our survival. Pain usually makes us change our behaviour by stopping what we're doing or avoiding certain activities. Humans are built for survival, and so any mechanism that is designed to promote our survival is instant and obvious. So pain doesn't want you to ignore it. It's a hardwired biological function that's been reinforced over thousands of years of evolution. Pain is also complex, so information that is gathered by our nervous system about sensory input is added to things like past experiences, emotions, beliefs, and values. And this is all processed by our brain to decide whether or not pain is experienced. So all over our body, we have receptors called nerve endings or sensors, and different receptors detect different information. So that can include things like information, pressure, touch, chemicals. The information that is detected is sent through the nerves to the spinal cord, and that information helps us to understand our world and helps shape how we would interact with it. The informational message that is sent is like a message asking, is this something we should be concerned about? And then the spinal cord acts like a kind of sorting office, and it decides when and which messages are then sent to the brain. It doesn't send all the messages. For example, we're not always constantly aware of when we're being touched, so we're not always feeling our clothes, for example, and sometimes we can't remember where we got a bruise from. When enough concerning messages are received by the spinal cord, it then sends them on to the brain, and the brain processes those messages and decide whether the body is at risk of harm or injury. And if it decides that it is at risk, we will feel pain. And that is so to get us to react, to get ourselves out of the way from the threat. This happens quickly, it's instantaneous, it's without our awareness of it happening. What we also know is that our nervous system is plastic and it adapts to our needs. So when the brain needs to monitor an area more closely, such as learning a new skill or for an injury, it lays down more nerves so that the brain can monitor that area more closely. And so signals move more quickly between the brain and that area. Much like when we're learning a new skill, we have to kind of practice it over and over, and then it becomes automatic. And this happens with pain. So next, let's think about acute and chronic pain. Acute pain is a helpful way of detecting a sign of injury or damage. So it's what will make us move our hand away instantly when we touch something hot, or tells us that our body needs attention when we have an infection, for example. According to the International Association for the Study of Pain, chronic pain is pain that has persisted beyond normal tissue healing time, which in the absence of other factors is generally taken to be around 3 months. This makes it different from the acute or warning pain that helps protect the body in the short term. Pain can start with a definite problem at a specific time, or it can come gradually for no obvious reason. It can even come on sometime after an event. So you might manage an activity at the time and then feel pain afterwards. You might feel the pain in a specific part of your body, or it could feel like it's everywhere. The pain can be there all of the time, or it can come and go. Sometimes you might feel more sensitive to pain, and sometimes it can flare up, meaning that it can become very bad or it can get worse quickly and unexpectedly. Even if you do things like take medication or rest, chronic pain may not go away. Pain is designed to help us. It tells us not to use a part of our body that is damaged, so it gives us a chance to heal. And it's like an alarm system in our brain, warning our body not to harm itself. With chronic pain, that alarm keeps going off even after the danger of further injury is gone. Our brain thinks it needs to protect the area, and it does that with pain. So a vicious cycle that can then happen. The longer that pain persists, the quicker the brain is at sending the messages. And the quicker the messages are sent and received around the brain and body, the more danger the brain concludes that we're in. Therefore, the nervous system needs to warn us even more, so we experience more pain. I want to note here that chronic pain is real. So some of you here may have had experiences where a health professional, maybe someone you know, has suggested that your pain is in your head or it's not real. And we know that that is not the case. All pain is real pain, even if we cannot find an obvious cause. And the distress and the impact of the pain is a normal response. Unfortunately, this is one of the cases where your body's protective functions here to produce a real experience of pain to keep you safe is not helping you. So it's like that oversensitive alarm system that's going off when you don't need it to. Why does pain persist? So there is a theory that persistent pain is due to nerve sensitization. So when pain lasts for a long time, nerves in the body can become more sensitive than normal. This can mean that things that usually would not feel painful become painful. And it's like that alarm system stays on even when there is no longer clear danger. Nervous system changes. So our nervous system can learn pain, meaning that it becomes sensitized to pain and more alert to it. It means that it's more easily triggered by sensory triggers such as touch, temperature, change or pressure, even when there's no ongoing harm or damage to the body. This can mean that our brain and spinal cord send pain signals even when there is no longer damage present. Also inflammation, so the body's immune system can continue to produce inflammation long after an injury, which can contribute to pain. Also psychological changes. So due to the stress of living with chronic pain, our mood, how we think, how we feel, and what we do often changes. This affects our overall mental health and well-being, and the emotional distress can make the pain feel worse, and the pain increases our emotional distress. And this creates what we would refer to as a vicious cycle. So how does what you feel, what you think, and what you do come into our understanding of pain? Well, it fits here in our psychology. Pain causes changes to our psychology, and part of that is how we feel, what we think, and what we do. As I've described before, pain is a protective mechanism that wants you to pay attention to it. The experience of being in pain is one that we can't ignore, and the natural response to pain is to try and find ways to stop it, avoid it, and escape from it. However, often that's not possible and it can result in more distress. As a result, we might notice experiencing difficult and distressing thoughts, emotions, and sensations, and our natural response to that is to try and control or avoid it. Unfortunately, this can lead to the development of unhelpful coping mechanisms that may help us to feel better in the short term, but in the long term lead to us not living the life we want or feeling engaged fully in our lives. So, as such, it's not surprising that there is a psychological impact of chronic pain, and it can lead to changes such as depression, anxiety, changes to thinking and behaviour, emotional changes, a sense of loss of control, difficulty adapting, perhaps a sense of loss of role or identity. If you can identify with any of this, I'm sure that you've tried many ways to manage your pain and move forward. And you may even have started to feel helpless or hopeless in managing the pain, and that's not unusual. However, there are helpful ways of managing pain and dealing with the emotional and psychological impact to find a way of living well with pain. So I want to introduce you to this idea of primary and secondary suffering. So we can understand the distress experienced as a result of pain as a combination of both primary and secondary suffering. Primary suffering is the pain and the physical sensations that come alongside that. And secondary suffering is what I've illustrated here. So that's the impact of the pain on our thoughts, our emotions, our physical sensations, and our behaviours. So the types of thoughts experienced might include things such as my life will never be the same, I can't cope, others find me a burden. Common emotions can include anxiety, depression, anger, guilt, shame. Common behaviours, avoiding or withdrawing from situations, people, events, engaging in unhelpful coping mechanisms such as drugs, alcohol, overeating, boom-bust cycles, overworking, self-neglect. Just to tell you a bit more about what I mean by boom bust. So this is where you may notice feeling better one day. So you might have reduced pain and therefore you might overexert yourself. So understandably, perhaps trying to get everything done that you've been unable to do due to the pain. And we call that the boom. You may then notice that you bust afterwards and feel exhausted or have increased pain and need to rest more after this boom period. And that can lead to a cycle of deconditioning where you might notice over time that your pain increases, perhaps your ability to engage in activities reduces because of the pain and because of potentially fatigue or muscle weakness that can come alongside that. You'll also notice that other physical symptoms come alongside the pain, such as fatigue. So what can be done? Well, we may not be able to get rid of or reduce the pain, but we can reduce the secondary suffering. And there are two main therapies that are proven to be beneficial in doing this and are recommended by the National Institute for Clinical Excellence. Cognitive behavioural therapy. So that's a therapy that helps us to understand how cycles of thinking, feeling and doing can keep us stuck in distress. And so with pain, a CBT therapist and client would think together about the unhelpful cycles that have come about as a result of the pain and find ways to manage and overcome them. So we would do this by finding alternative ways of managing unhelpful thoughts and behaviours in order to feel better and live better with pain. And then there's acceptance and commitment therapy, also known as ACT or ACT. It's a therapy that helps us to find ways of living well with pain. So it helps us to understand what we value in life and enables us to develop skills to live life in line with these values. It helps us find ways of accepting the pain rather than fighting with and struggling with it. This doesn't mean we have to like it or want it. It simply allows us to let go of the fight with it, the energy that takes and the power that pain has over us. Acceptance and commitment therapy helps us to be more mindful and present, allowing us to experience more of the here and now, rather than being caught up in difficult thoughts and feelings that can feel as though they're taking over our lives. It helps us to make moves towards a meaningful life despite the pain. As a CBT therapist, I incorporate both CBT and acceptance and commitment therapy into my work. So what can you do next? So if this has resonated with you and you feel that you're ready to make a change, then please do get in contact. As I said at the beginning, I offer sessions of CBT both remotely and in my office in Rochester High Street. I offer a free 15-minute discovery call where you'd be very welcome to ask me questions about tonight's talk or how CBT or ACT could help you on your journey to wellness. You can follow us on social media. We have both Facebook and Instagram, blogs on our website as well that you might find interesting. So yeah, thank you very much for listening and giving your time and attention to this information. And I hope that you'll be able to take something helpful away with you from it. Thanks very much.